Good morning, students. Myself, Dr. DHIBIKA, Assistant Professor in the Department of Microbiology, Sri Lakshmi Narayana Institute of Medical Sciences, Puducherry. Today, let's discuss about the microorganisms, which is having oncogenic potential. So, today's learning objectives will be, the students will be able to understand at the end of the session about human oncogenic viruses and its associated malignancies, example of DNA and RNA oncogenic viruses and their mechanism of oncogenesis, and examples of non-viral organisms, bacterial, fungal, and parasitic. So under the viral category, we have DNA virus and RNA viruses. So under DNA virus, we have papillomaviridae by polyomaviridae family. So under papillomaviridae, we have human papilloma viruses, which is causing cervical carcinoma, other genital tract carcinoma, namely anal, vulval, vaginal, penile cancers. And they also cause esophageal carcinoma, pharyngeal carcinoma, and oropharyngeal carcinoma. So under this family, we have one more virus, namely Merkel cell virus, which is causing Merkel cell cancer of skin. So continuation of the DNA viruses, which is causing malignancy, we have two more family, herpes viridae and hepatnaviridae. Under herpes viridae, we have two viruses. They are Epstein-Barr virus and human herpes virus 8. So this Epstein-Barr virus causes 4 malignancies. They are Burkitt's lymphoma, Hodgkin's disease, nasopharyngeal carcinoma, and B-cell lymphoma. So this human herpes virus 8 infection can cause Kaposi sarcoma, Castleman's disease, primary effusion lymphoma. So under the hepatnaviridae family, we have hepatitis B virus, which is causing hepatocellular carcinoma. So we have done with the DNA viruses. Now moving on to the RNA viruses, which is having oncogenic potential. So under this, we have two family. They are Retroviridae and Flaviviridae. So under Retroviridae family, we have HTLV virus 1 and HIV virus. HTLV is human T-cell lymphotropic virus 1 and HIV is human immunodeficiency virus. So this HTLV1 causes adult T-cell leukemia or lymphoma. HIV causes AIDS-related malignancies. So under Flaviviridae family, we have hepatitis C virus, which is causing hepatocellular cancer. So what is the overall overview of viral oncogenesis generally? So viral oncogenesis is a complex multi-step process requiring a prolonged contact time. So it needs a chronic persistent infection from years to decades to establish oncogenesis in human cell. Okay. So that's why it occurs only in a smaller percentage of infected individuals. So multiple oncogenic events will transform the host cells into cancer cells. So viruses contribute, in that virus contribute only a smaller portion for this oncogenic events. So what are the oncogens responsible for transforming normal host cells into cancerous cells? So these oncogens, they encode certain proteins called oncoproteins, which is triggering the transformation of normal cell into tumorous cell. Okay. So these are the various oncogens. They are viral oncogens, V-onc, cellular oncogens, C-onc, and proto-oncogens. So these viral oncogens, they are present normally in the viral genome, which is essential for the virus to replicate. And they are expressed only in certain group of retroviruses called acutely transforming retroviruses. They are not expressed in all viruses. Okay. So in C-onc, they are called cellular oncogens, which is the cellular counterpart of viral genes present in cancerous cell. Okay. Whereas proto-oncogens, they are counterpart of viral genes, which is present in the normal host cells. Here it is cellular oncogens is the part in the cancerous cell, whereas proto-oncogens is a part in the normal host cell. Okay. So what are the genes which is regulating our normal cell growth? We have 4 categories of genes which is regulating normally our cell growth and proliferation. If there is any defect in these regulatory genes, there comes your tumorous cell proliferation. Okay. So they are proto-oncogens, anti-oncogens or tumor suppressor genes, apoptosis regulatory genes and DNA repair genes. They have a check of normal cell growth and proliferation. If there is any defect or dysregulation in these regulatory genes, you will end up in malignancy. So what are the events which is occurring before the onset of oncogenesis? There should be a persistent establishing infection. Okay, there should be a chronic persisting infection in our body, and that invading organism should evade our host immune response by hiding their expression to the immune cells. That is one of the mechanism, by evading the host immune response and by suppressing our immune cells and immunity and genetic susceptibility. Individual host cell has a different genetic susceptibility and the retention of viral nucleic acid inside the host cell. By these mechanisms, they establish the first step of oncogenesis. So the first step is establishing persistent infection. So there is a prolonged interaction between the tumor virus and the host cell, which is essential for oncogenesis to develop. It's possible only when the tumor virus establishes long-term persistent infection in the host cell. So how the host immune response is evaded by these microorganisms is by this mechanism, by restricting the expression of viral genes, which is going unnoticed by the immune cells to get attacked. Example is EBV infection in B cells. The other mechanisms by which our host immunity is evaded is by infecting the sites which are relatively inaccessible to immune response. Example is HPV infecting epidermis. Okay, or else certain genes will be undergoing mutation which allow the virus to escape from the host cell-mediated and humoral-mediated immunity. Okay, and infection and suppression of immune cells itself. Example, CD4 cell suppression by HIV. So these are the various mechanisms by which the organisms evade a host immunity. And the other mechanism is immunosuppression. The host will allow the cancer cells to proliferate and escape the host immune response. They are observed in immunosuppressed organ transplant recipients and HIV persons, where there is increased risk of EBV and HPV associated malignancies. So what is the host cell susceptibility to genetic changes? Okay, so we have in our body permissive cells and non-permissive cells. Permissive cells generally support any viral growth and replication of a virus. Okay, whereas non-permissive cells do not support any growth or replication. If there is infection happening in a non-permissive cell, the risk of oncogenicity is more rather than in a permissive cell. Okay. So what is the mechanism of retention of viral nucleic acid inside the host cell contributing to the oncogenicity? So when any viral nucleic acid is retained inside the host cell, there is a chance to maintain a stable genetic change which is occurring in a cell. Okay. So the various copies of DNA, of both DNA and RNA, are integrated within the host cell chromosome, and certain RNA viruses can get reverse transcribed to DNA virus. Okay, so they have a constant stable genetic change there, establishing oncogenesis there. Okay, here hepatitis C virus is alone an exception. They never get integrated or reverse transcribed to DNA. Hepatitis C alone is an exception there. Their particles are just maintained inside the host cell without any integration or reverse transcription. Okay. So coming on to the oncogenic RNA viruses, we have acutely transforming viruses and slow transforming viruses. Okay. So under acutely transforming viruses, they have viral oncogenes, V-onc, in their RNA. After just getting integrated with the host chromosome, they induce oncogenesis. Okay, they are highly oncogenic viruses which can cause malignancy within weeks to months. Example are animal retroviruses causing sarcoma. The named virus is Rose sarcoma virus. They do not generally infect humans. So under slow transforming viruses category, we have two viruses, that is HIV virus and HTLV virus 1. So they possess additional regulatory genes called TAX gene for HTLV1 and TAT gene for HIV. After inserting into the host chromosome, they activate the host cell machineries to induce oncogenesis. Okay, they have relatively a low oncogenic potential and they are dormant for a longer time. So they have a long latency period to develop into malignancy. So coming on to HTLV virus, they belong to the family Retroviridae under the genus Delta retrovirus. The two important members under this family are HTLV1 and HTLV2. So HTLV1 are associated with several malignancies. They are adult T-cell leukemia par lymphoma, cutaneous T-cell lymphoma, and tropical spastic paraparesis. So this virus infection, how it is transmitted is through this various routes, namely from mother to child. Vertical transmission or via breast milk is the most common route. The other one is sexual route and the other one is through infected blood and blood products. Okay. So the target cell for this HTLV virus 1 and HIV virus is immune cells. They are CD4 T cells. Okay. So this GLUT1, glucose transporter protein 1 receptors are present in the CD4 T cell, which is the receptor for the virus attachment. Okay. After this, what is the mechanism happening? This HTLV1 express a unique gene called TAX gene, which has oncogenic potential. So this TAX gene is capable of activating the transcription of several genes which is involved in the T cell proliferation. They are genes encoding interleukin-2, IL-2 and MGF. They are myeloid growth factor. Okay, they promote the cell growth cycle. This TAX protein will inactivate the cell cycle inhibitor P16INK4A, thereby activating the cell cycle enhancer, that is cyclin D, thereby promoting post cell growth cycle. So this TAX gene activates one more factor that's called nuclear factor kappa beta, which is a transcription factor, which also regulates certain anti-apoptotic genes. So your apoptosis will be inhibited, thereby leading to proliferation of the cancerous cell. Okay. This TAX gene interferes with the DNA repair pathways also, leading to a sustained DNA mutation, ending in a malignancy. So coming on to HTLV2, this is endemic in certain Native American tribes and in African countries. Transmission and replication of HTLV2 is similar to that of HTLV1. Its pathogenic potential is not well identified. It is uncertain. So what are the AIDS-associated malignancies caused by HIV virus? We have AIDS-defining cancers. Okay. So under AIDS-defining cancers, we have non-Hodgkin's lymphoma, Kaposi sarcoma, and invasive cervical carcinoma. Under non-Hodgkin's lymphoma, we have three types. Okay. We have Burkitt's lymphoma, which is associated commonly with Epstein-Barr virus infection. Diffuse large B-cell lymphoma, preliminarily affecting your central nervous system, and primary effusion lymphoma associated with human herpes virus 8 infection. So the other one is Kaposi sarcoma in association with human herpes virus 8, invasive cervical carcinoma in association with human papilloma virus. So what are the non-AIDS defining cancers? We have classical Hodgkin's lymphoma, anal cancers, and lung cancers. What is the mechanism of oncogenesis in HIV infection? Okay, so we have an altered cytokine expression. There will be B cell stimulation and associated infection. As the person is having HIV infection, his immunity will be compromised and he'll be having so many co-added associated infections. They are HPV infection, human papilloma virus infection, Epstein-Barr virus infection, human herpes virus 8 infection. So there is a genetic alteration happening in the host cells. Okay, and we have TAT protein, which is an early non-structural protein of HIV, which is necessary for viral replication, which is linked to the pathogenesis of malignancy. Okay. So coming on to the hepatitis C virus associated malignancy. Hepatitis C is the only oncogenic virus which doesn't get integrated to the host chromosome or neither get remained inside the host cell. Okay. So it is strongly linked to the pathogenesis of hepatocellular carcinoma in humans. Okay. This oncogenic mechanism of hepatitis C virus is less well defined than those of hepatitis B virus infection. So similar to hepatitis B virus, this chronic liver cell injury and persistent infection and compensatory regeneration is the main mechanism for this hepatitis C virus associated malignancy. So the components of HCV genome, its core protein, will activate a number of growth promoting signal transduction pathways leading to malignancy in hepatitis C virus infection. So what are the oncogenic DNA viruses associated malignancy seen in Epstein-Barr virus infection? Okay, this EBV is associated with several malignancies, namely Burkitt's lymphoma, that is a tumor of jaw, most commonly seen in African children, nasopharyngeal carcinoma, Hodgkin's lymphoma, mixed cellular type of Hodgkin's lymphoma, and non-Hodgkin's lymphoma. So what are the mechanism of oncogenesis happening in Epstein-Barr virus infection? So this Epstein-Barr virus, preliminarily, it has an affinity for B lymphocytes. Their target entry is into the pharyngeal epithelial cells. They attach to a complement receptor, namely CD21, which is present on the pharyngeal epithelial cells, and they start to infect the B lymphocytes. This EBV infection they are not actively replicating inside the B cell, and they do not cause the lysis of B cells also. Okay, they are establishing a chronic latency inside the B cells, so they get immortalized, and their ability to grow indefinitely in cell line is immortalized. Okay, so when immunity is compromised, this latently infected B cells will get the oncogenicity potential. Okay. So there should be, as I said, there should be a chronic persistent EBV infection establishing a malignant transformation of B cells by expressing certain genes. In chronic infection only, this EBV virus will express two antigens. They are LMP and EBNA. LMP is latent membrane protein. EBNA is EBV nuclear antigen. If these genes are expressed in persistent infection only, your malignant transformation occurs. So we'll discuss one by one. LMP. LMP is latent membrane protein gene, which is the most important viral gene, which is coated on the surface of the infected cell, and they behave as an active CD40 receptor, which is a key recipient of helper T cell signals. Okay, thereby it stimulates the B cell growth. Okay, again, this LMP1 activates the nuclear factor kappa beta and JAK-STAT signaling pathway, which is promoting again the B cell survival and proliferation. So this LMP is the most important viral oncogene expressed in EBV infection. They also prevent apoptosis by activating the anti-apoptotic factor BCL2. LMP induces the expression of pro-angiogenic factors. They are VEGF. You might be knowing vascular endothelial growth factor. They are in turn contributing to the oncogenesis of nasopharyngeal carcinoma. Again, this viral, the other antigen, what we had discussed in the previous slide is EBNA. Viral EBNA2 will activate the host cell cyclin D we saw on the previous slide. Cyclin D is a cell cycle enhancer. So your cell will be proliferating and the proto-oncogene SRC will be altered, thereby promoting the cell proliferation. Okay. And we have viral interleukin 10, which is secreted, which also modulates the transformation of B cell in EBV infection. Okay. So what is the role of host immune response here in EBV infection? If there is an effective host immune response, this malignancy can be prevented. Okay. If host immune response is compromised, the transformation of EBV cell into a malignant cell possibility is more. Okay. So normally in our body, the oncogenicity is kept under control by anti-LMP1 antibodies. As I said in the previous slide, LMP antigen 1, if it's expressed only by this EBV virus only, you'll get oncogenesis, malignancy. If it is kept in control by anti-LMP1 antibodies, your chances of developing malignancy will be controlled. Okay. So, this type of expression of oncogene, LMP oncogene, is markedly enhanced in immunosuppressed individuals. So they are not able to produce anti-LMP1 antibodies. Okay. So B cells, whereas B cells in immunocompetent individual can still undergo malignant transformation if there is a pre-existing mutation. Example of this is translocation in the place of 8 and 14, which in turn can activate the growth promoting MYC oncogene. In immunosuppressed individual, they will not able to express this anti-LMP1 antibodies, whereas in immunocompetent individual, if there is a possibility of mutation, there will be expression of c-MYC, which in turn can cause malignancy in EBV infection. Okay. So the other DNA virus, human herpes virus 8 associated malignancy. So in immunocompromised individuals like HIV infected people only, this virus is causing these many malignancies. Okay. HHV8 is associated with two types of malignancy. They are Kaposi sarcoma and primary effusion lymphoma. This primary effusion lymphoma is a body cavity based lymphoma. You can see the picture here. This arrow is showing a Kaposi sarcoma in the heart palate of a HIV infected individual. Okay. So what is the mechanism of oncogenesis in human herpes virus infection 8? Okay. They predominantly infect the endothelial cells or they attack the hematopoietic progenitor cells. So here the transformation of malignant cell is directly related to the expression of early lytic genes of HHV8 such as viral G protein coupled receptor K1, viral interleukin 6 and K15. Okay. So coming on to the other virus under the DNA category, we have human papilloma virus infection. So this human papilloma virus has a selective tropism. Tropism is the selective affinity for the epithelium of skin and mucous membrane. So they cause an array of infection ranging from benign warts to malignant neoplasm of the cervix. So what about the morphology of human papillomavirus? It is a non-enveloped virus measuring 50 to 55 nanometer in size with icosahedral capsid, and it is a circular double-stranded DNA. So what are the various clinical manifestations caused by this human papillomaviruses? Starting from benign warts to epidermodysplasia verrucomatous, cervical lesions, head and neck lesions, pityriasis versicolor-like lesions. So what is the mechanism of oncogenesis happening in human papillomavirus infection? See here, the human papillomavirus will be expressing so many structural and non-structural genes. In that, we have certain genes called E genes. Okay, they will be expressing genes, E genes from 1 to 7. Okay, in that HPV E6, see the picture here. This HPV E6 will be inhibiting the tumor suppressor gene, namely P53 gene. So this indirectly inhibits the expression of BAX gene, which is a gene responsible for regulating apoptosis. If this regulation is inhibited, the expression of BAX gene is not there, thereby inhibiting apoptosis. So if apoptosis is inhibited, your cell will be proliferated and transformed into a cancerous cell. Okay. This HPV will express the other virulent oncogenic gene, namely E7. Okay. This E7 also inhibits this P53. Along with that, it can also inhibit P21 gene and cyclin D gene, and also RB gene. This is retinoblastoma gene, which is a proto-oncogene. Thereby, by these various mechanisms, it can inhibit the normal growth, and it will allow the normal cell to abnormally proliferate. Okay. So among the human papilloma virus, the expression of E6 and E7 is preliminarily responsible for malignant transformation. Okay. So how to diagnose this human papilloma virus infection in the laboratory? We have molecular methods, namely PCR or hybrid capture assay, which detects the HPV DNA component, and they identify specific virus types also by targeting genes coding for E6, exclusively E6 and E7 region. I said, right? The HPV virus will be expressing so many E genes starting from E1 to E7. In that, E6 and E7 is only having predominantly oncogenic potency. So that can be specifically targeted by this hybrid capture assay. Okay. So most of the lesions of HPV are visible to the naked eye only in the localized site. Okay. So solutions of 5% acetic acid can be applied to improve the visibility of lesions in naked eye. Okay. So continuing with the laboratory diagnosis of HPV infection, you can do a histopathological evidence, which can be detected by pap smear. Pap smear you can take from the cervical or anal scraping, or you can do staining and you can observe the human papillomavirus, and you can do histopathological staining of biopsy sample. Okay. Antibody detection is not much useful in diagnosing human papillomavirus infection. So what is the treatment of human papillomavirus malignancy? The mainstay is removal of the lesion, either by cryosurgery, electrodesiccation, surgical excision, and laser therapy. You can apply certain topical preparations of podophyllum, interferons, or imiquimod. They are interferon inducers, which can be used for the local genital parts, but recurrence is very common with the topical treatment. Okay. So how do you prevent this human papillomavirus infection? One of the most important vaccine preventable malignant viral infection are human papillomavirus and hepatitis B virus. Okay. So we'll see how to prevent this human papillomavirus infection. So we have a human papillomavirus vaccine. This is recommended to all adolescent boys and girls at the age of 11 to 12 years. This is basically a subunit vaccine, which is consisting of virus-like particles composed of HPV L1 proteins, which is produced artificially in yeast by DNA recombinant technology. So we have both 9-valent and bivalent vaccines licensed in India. So what are the named 9-valent vaccine? The brand names are Gardasil 9 and Mersec. So 7 common cancer causing serotypes are included in this vaccine. They are 16, 18, 31, 33, 45, 52, and 58. And the 2 non-cancer causing serotypes, namely 6 and 11, is also covered in this 9-valent vaccine. Okay. So the other category is quadrivalent vaccine. They are earlier version, which is including the type 6, 11, 16, and 18, which is still in use. And bivalent vaccine, the brand name is called Cervarix and GSK. They cover only high-risk serotypes, namely 16 and 18. So we have 9-valent vaccine and bivalent vaccine available. So coming on to the hepatitis B virus associated malignancy. Hepatitis B virus in association with hepatitis C co-infection is responsible for 70 to 85% of HCC, hepatocellular carcinoma, worldwide. What are the mechanism of oncogenesis happening in hepatitis B virus? So HPV genome does not contain any oncogenes as such. However, in the target cell, they just get integrated with the host genome randomly. Okay. There is no oncogene expression here in the mechanism of hepatitis B virus infection. They cause only immunologically mediated chronic inflammation, which transform the hepatocytes into hepatocellular carcinoma. There is no expression of oncogenes, only the mechanism is immunological mediated chronic inflammation leading to hepatocellular carcinoma. So there is a chronic viral infection. So the oncogenesis is explained in brief in hepatitis B infection. when there is a chronic persistent infection of hepatitis B inside the hepatocytes, the hepatocellular injury occurs. So, which will be compensated by the proliferation of hepatocytes regularly. So, during this regenerative process, a plethora of growth factors, so many growth factors, namely cytokines, chemokines, and other bioactive substances will be released by the activated immune cells, which in turn promote the cell growth, survival, tissue remodeling, and angiogenesis. Okay, this is responsible for a malignant transformation. Okay, so this activated immune cells, they also produce reactive oxygen species, which are genotoxic and mutagenic. And one important key molecular step is there is activation of nuclear factor kappa beta pathway in the hepatocytes, which is blocking the apoptosis, allowing the dividing hepatocytes to incur genotoxic stress and they accumulate mutation, resulting in oncogenesis. Okay. So we have a regulatory gene in hepatitis B virus genome. They call hepatitis B X gene, which activates the transcription of cellular as well as viral genes. Okay. And there is also deletion of tumor suppressor gene. Okay. Which can cause secondary rearrangement of chromosomes, multiple deletions leading to oncogenesis. So we are done with the viral part of oncogenicity. Now we are moving on to the non-viral oncogenic organisms. So we have bacteria, parasites, and fungi. Under bacteria, we have two organisms importantly. That is Helicobacter pylori and Bacteroides fragilis. So Helicobacter pylori causes carcinoma of stomach as well as marginal zone B-cell lymphoma of stomach. Okay. And Bacteroides fragilis can cause colon cancer. So under the parasites category, we have 4 parasites causing malignancy, namely Schistosoma hematobium, Schistosoma japonicum, Clonarchus sinensis, Opistharchus viverti. So Schistosoma hematobium causes carcinoma of bladder, basically squamous cell carcinoma. This japonicum causes colorectal cancer and carcinoma of liver. Clonarchus sinensis causes carcinoma of bile duct, cholangiocarcinoma. Opistharchus viverti causes cholangiocancer as well as carcinoma of liver. Okay. Under fungal category, we have Aspergillus flavus, which is producing aflatoxin, causes cancer of liver. Okay. So if the question is asked about non-viral oncogenic organism, you can list out the bacterial, parasite, and fungal etiologies for oncogenesis. Okay. So we'll see one by one in short. Okay. So Helicobacter pylori, what is the mechanism happening here in the oncogenesis? There is gastric colonization with first this bacteria, H. pylori bacteria, which results in the pathogenesis of peptic ulcer disease. They establish colonization first and leading to peptic ulcer manifestation. Okay. They serve as the most important risk factor for several malignancies happening in the GAT. They are gastric adenocarcinoma and gastric MALT. That is mucosa associated lymphoid tissue malignancy, lymphoma. Okay. So there is a lifelong H. pylori colonization. So your gastric malignancy chance is risk, whereas there is protection against esophageal adenocarcinoma. Okay. So what is the mechanism involved? This H. pylori colonization in humans induces genetic polymorphism, thereby enhanced activation of innate immunity, leading to polymorphism in cytokine genes, namely interleukin-1, or genes encoding bacterial recognition proteins, TLR, that is toll-like receptor. Thereby, it induces oncogenesis. Okay, what is the treatment for H. pylori? Treatment, you have a triple drug regimen, which is useful for patients with low-grade gastric MALT lymphoma. In contrast, it has no benefit in the treatment of gastric adenocarcinoma. Coming on to Schistosoma hematobium. So now we are moving into the parasitic cause of malignancy. So under parasites, we have Schistosoma hematobium, which induces metaplastic changes in the urinary mucosa by creating a chronic persistent infection leading to carcinoma of bladder. What are the predisposing factors required to establish this malignancy? So the diet containing nitroso compounds, example, Egyptian food, cheese, fava beans, raw salted fish, okay, and secondary bacterial infection causing frequent cystitis, genetic factors, namely activation of RAS or inactivation of P53 or the predisposing factors to induce changes and cause cystosoma hematobium infection in the urinary mucosa. Okay. So what are the various types of presentation of cancer in cystosoma infection? We have squamous cell carcinoma, which is the most common type, and you have transitional cell carcinoma. So the squamous cell carcinoma is the most common type, the same with high to moderate warm burden. If there is high to moderate warm burden infection of this cystosoma hematobium, your common presentation is squamous cell cancer. Okay. This other types, transitional cell carcinoma, is occurring in areas where there is lighter warm infection. Okay. So coming on to clonarchus and ophistharchus, they are liver flukes, you might be knowing. Under clonarchus, we have clonarchus sinensis and ophistharchus viverrini, which cause chronic irritation of the bile duct for longer periods, leading to bile duct carcinoma. They call otherwise cholangiocarcinoma. In addition, this ophistharchus is also associated with carcinoma of the liver. Okay. So what are the risk factors for this bile duct carcinoma? Are elderly people in the age group of 60 to 80 years and pre-existing primary sclerosing cholangitis. These risk factors are there. Your chances of development of cholangiocarcinoma and liver carcinoma is more in infection with clonarchus and ophistharchus. So along with that, there is inhibition of tumor suppressor gene, P53 gene, and there is release of cytokines, namely interleukin 6 and tumor necrosis factor F. These are the underlying mechanism of oncogenesis postulated in liver fluke infection. Okay. So today's class, we dealt about the organisms associated with oncogenic potential. We have viral category in more content rather than the non-viral category. If a question is asked, you'll have to write the viral oncogenesis first compared to the non-viral oncogenesis. So under the viral category, you have DNA virus, RNA virus, explain each with example. And in the non-viral category, you can list out the bacterial, fungal, and parasitic cause and few important points on the non-viral category. Okay. Hope you gained a sound knowledge about the organisms harboring oncogenic potential. Thank you.